It's on? You guys can hear me? Oh, yes, we all can hear. We're matching up technology. It's not quite 10, maybe 45 seconds. Yes, ma'am. They're still having fun back in the gathering space. And Apple has not said that it's 10 o'clock. It is now 10 o'clock. Welcome, everybody. My name is Tracy Keebler. Most of you know me. A lot of you know me. I'm the founder and executive director of START Senior Solutions. And it is so good to see all of you here today. What is my great pleasure is that there are many of you that we know, but there are a lot of you who are brand new to START Senior Solutions, and that makes me happy to be able to tell the story of START Senior Solutions to new people. So, START Senior Solutions does two things. We are an education and advocacy organization serving older adults and caregivers. So education is like today. We're here learning about brain health. And advocacy is what we do when we help older adults who are saying something like, this is so complicated, I don't know where to start. I don't know what to do, and they have that deer in the headlight look. So 13 years ago in February, I'm projecting, so next February we will be 13 years old. And when I started the organization, I wanted to create an organization that would first become a trusted resource for older adults and caregivers in the community. And I think we're on our way. And the way that I know that is because of who refers their clients to START Senior Solutions. Some of the top litigation and elder law attorneys refer their clients to START Senior Solutions. Police departments, fire departments, and now even hospital social workers refer a lot of their patients to START Senior Solutions. So I wanted to be a trusted organization. Then I had a big prayer. Lord, if we can ever hire staff, can we hire people who are really, really smart? Maybe way smarter than me, that would be helpful. So we got to hire some of the most experienced nurses and elder advocates, I think, that are in the state. Our elder advocates used to advocate at the state level for older adults, and now I have 3 of those people on staff, and we have 2 nurses and everybody has decades of experience in the aging space. So with that level of knowledge and experience, START Senior Solutions gets to change the trajectory of lives. And that's what we do in advocacy. And what that might look like is the woman who called START yesterday, and she said, I'm homeless. I've been living in my car. I fell. I'm in rehab. And the hospital social worker told me to call you because he said you could help me stabilize my housing. We will be meeting with her this weekend. Or it might sound like, advocacy might sound like the call that we got from a woman who just lives down the hill from the church. She fell and broke both femurs. When her head hit the pillow of the rehab setting that she was in, her insurance company sent her a note and said, you have been denied all of your rehabilitative care. We said, I don't think so. And 95 days later, the benefit is for 100 days. She got 95 days of covered care in rehab. That's what advocacy looks like, and that's how START Senior Solutions changes lives. And, well, I had another requirement. I wanted to provide all of this support free of charge. And that's what makes START Senior Solutions unique. We do it for free. We have some of the finest staff in the state, and we are now this trusted resource. So if this sounds like a community that you would like to be a part of, we would love to have you be a part of the community, whether you become a donor or a client, or just someone who says to your friend, you know, I learned about this organization, Start Senior Solutions, and I think you would be benefited if you gave them a call. Here's the executive director's phone number. We have made it easy. If you want to make a donation, there are envelopes around, not only in here, but out in the gathering space. And if you can't make a donation today, that's okay. Take an envelope home and think of us at Christmas time. So now I would like to turn this whole thing over to introducing Dr. Terry Barclay. And I'm not sure if Dr. Barclay remembers, but when I started my gerontology journey and getting my master's degree in gerontology, the Department of Human Services offered some classes that Dr. Barclay was teaching. And I got to be a student of his. And I learned so much. We had multiple days of class time together. So you're gonna learn a lot today, I know, so put your seatbelt on. So Dr. Barclay is a fellowship-trained neuropsychologist with both research and clinical expertise in topics we really care about in this room, aging and dementia, right? Yay. And he's currently the director of neuropsychology at HealthPartners at Regions Hospital in St. Paul, and he's also an adjunct professor at the University of Minnesota. And it's with that I would like to say welcome, Dr. Barclay.
Good morning. I want to thank Tracy for the invitation to be with you this morning, and thank all of you for showing up on such a beautiful, little windy, but beautiful Saturday morning. I am really pleased to be here with you for the next 90 minutes. I have a lot of information to share, much of which I think will be helpful and interesting to you. If you have questions along the way, please keep track of them, write them down, and at the end I'll save some time so that we can make sure that your questions are answered. And I'll also hang out for a little while after the presentation. If you have more questions and you have time, you can come up and chat with me. I come to Alzheimer's disease both from a professional and personal standpoint. I was very close with my mother's parents. My grandfather developed vascular dementia when I was in junior high, and my grandmother developed Alzheimer's disease at the very end of her life, and we took care of her at home until the very end when she died at 97. All of my work, education, and career has been spent in aging and neurodegenerative diseases, including Alzheimer's. So what I want to share with you today, a message of hope about the fact that you can do things now to change to lower your risk of ever getting a neurodegenerative disease. I think this mic is struggling a little bit. So the first thing that we're going to talk about is don't You want to just give me a handheld?
Yeah.
Yeah. Sure.
Oops.
No. Oh, yeah. Thank you.
Got it? Thank goodness. Much better. Okay, so I'm going to start by talking about all of the modifiable risk factors, all the things based on science, neuroscience, over the last 50 years that teaches us that there are things that you can do to lower your risk. Then I'm going to talk a little bit about the signs and symptoms of Alzheimer's disease. We'll talk about how dementia is diagnosed in the clinic, how it's treated. I'm going to spend a little bit of time at the end discussing how to support caregivers, if any of you in the room are caregiving for somebody with dementia. We'll chat about that. I'm going to talk about resources, and if there's time at the end, I'll give you a little bit of a heads up about where the research is going in Alzheimer's disease and treatment. Sound okay? All right. So remember to keep track of your questions, and we'll address as many of those as we can at the end. This is one of my favorite cartoons. What do we want? Better memory. When do we want it? Want what? So, the last 50 years of research has shown us that there are a number of factors, some of which we can control and some of which we have no control over, that determine our individual personal risk of getting dementia. And this first slide is all the things that we cannot control. The first of which is age. So we can't stop the normal aging process. Of course, we're all aging, and our risk of Alzheimer's disease doubles every 5 years after the age of 65. So I always get questions about, is there a genetic link to Alzheimer's? What if I have a relative with Alzheimer's? Does that increase my risk? It does, but by a very small percentage. By far and away, our biggest risk of getting Alzheimer's is age. In fact, if we are lucky enough to live to the age of 85, the chances of all of us having Alzheimer's disease at that age are between 1 in 2 and 1 in 3. So age is the big risk factor. We can't change it. You can't change whether you have relatives with the disease, and we can't change our genetics. Again, there are some genetic links to Alzheimer's disease. For most of us, those are very small. In the case of some diseases, or some conditions rather, like Down syndrome, we know that individuals with Down syndrome, by the time they reach the age of 50, with 100% certainty, have the brain pathology of Alzheimer's disease. So researchers are trying to tap into that population of people to engage them in Alzheimer's disease research because they're at an incredible risk of developing the disease. Brain injuries, concussions also increase your risk of dementia, however, only a certain type of brain injury. The brain injuries that cause risk are those that lead to a loss of consciousness of 30 minutes or more. So if you've been knocked out for a couple minutes, couple seconds, numerous times in your life, not a risk factor, just the more serious traumatic brain injuries are. But the good news is that research shows there are many things that all of us can control, and you can start today. And I'm going to give you a lot of information about things that you can do differently. All you need to do is start with one thing, and I'll come back to that at the end. But we're going to talk about what physical activity does for the brain, cardiovascular conditions, obesity, intellectual and social stimulation, mood, diet, alcohol, and sleep disorders, just to name a few. I want to mention that a lot of the research and sort of startling findings over the last 30 years came from something called the NUN study. Has anyone ever heard of that? A few of you. David Snowden, researcher who actually went in Minnesota to many convents around the state and convinced the nuns to donate their brains to science and to be studied on an annual basis. And it was a very extensive study that is still going on today and has been going on for several decades. And this study and other studies like it have led to some really amazing information. One of the most startling is this, that by the time people show any signs or symptoms of memory loss, they have had Alzheimer's disease pathology growing in their brain for 20 years. So what this says is that Alzheimer's disease, in fact, is very slow. It also tells us that our brains are these amazing organs that can compensate for this pathology for many, many years before the pathology becomes too great and people start to develop thinking problems. So this is one of those very startling findings that the NUN study helped to uncover. Here's just some other little bits of information that I've found really interesting. From the nun study, researchers found that they could predict whether or not a nun would get dementia later in life by studying her writing sample that she submitted at the time that she was 18 and entered the convent. The density of the ideas and the vocabulary shown in those writing samples was related to risk. So those with greater idea density, a greater vocabulary, had a lower risk of developing dementia, showing that education and intellectual capacity has a relationship to our risk. The study also showed that not everybody develops dementia, even in very old age. Some of the nuns were in their early hundreds at the time that they died, and they did not have dementia. So we know that dementia is not an inevitability, and it's not normal aging. There's also a disconnect between the pathology in the brain and the severity of symptoms. So for example, when they studied the brains of two nuns who both passed away at the age of 85, the brain pathology in both brains was of the same magnitude. However, in life, only one of them had dementia, the other did not. So what's up with that? How could you have all of this pathology, the same pathology as someone who was diagnosed with dementia, but not have that level of memory or thinking problems? It suggests that the one who did not have dementia had lifestyle changes, was doing something differently that lowered her risk of having memory problems. And so this study is just one example of really a lot of very startling and interesting findings that are helping neuroscientists take things forward in terms of research. So I'm going to tell you a little bit more about what the research shows. This is one of my favorite quotes, and I learned this morning it's one of Tracy's favorites as well. A man's health can be judged by which he takes two at a time, pills or stairs. Of course, medication, pills sometimes are necessary, but not always. And if you, at the end of the talk, remember nothing else, remember this. When all things are studied that can prevent or slow down the process of Alzheimer's disease, reduce your risk of ever getting dementia, the number one thing you can do is move your body. Physical activity, by far and away, is the best thing that reduces people's risk of dementia. When you are moving your body, your brain is releasing a chemical called nerve growth factor. That chemical is surrounding the neurons, the brain cells, and making them stronger and resisting pathology. Exercise also brings more oxygen to the tissue, and this is really fascinating. This is a true fact. If you exercise regularly, you will increase the size of the memory organ in the brain. Now, understanding we all have different bodies, we all have different limitations. I'm not talking about running a marathon. I'm talking about any kind of exercise that works for you. Research shows the best type of exercise is aerobic or cardio, something that just gets your heart rate or your breathing elevated a bit. However, you could sit here today and flap your arms vigorously, and if that got your heart going, that's all it takes. Okay, so the type of exercise doesn't matter so much as getting your heart going. The goal, or the most robust prescription, is 150 minutes or more per week. That's the gold standard. But again, even 10 minutes more today than you were doing yesterday is a start. If you have hip problems, knee problems, peripheral neuropathy, all the stuff that can come with aging, you might have to get creative, and my recommendation is consider meeting with a physical therapist or a personal trainer and just saying, you know what, I'm going to give you 3 sessions, and in those 3 sessions, I want you to design a program of exercise for me that's comfortable and low impact, doesn't aggravate these problems I have, but gets my heart going. Go. And then try to follow that as best you can. So physical activity, extremely important. In second place is social activity. We know today that the risk of feeling alone and isolated, being inactive in terms of our social network, is equivocal to cigarette smoking, high blood pressure, and obesity. In other words, social deprivation, not talking to people, is damaging to our health and it's damaging to our bodies. Social connections are known to improve our immune system and to help our mood. And you see the last bullet there, a limited social network in midlife and late life increases the risk of dementia by over 60%. So research over the years has been very clear. If you take a group of 50 people who is out and about and social, and another group of 50 people who is sticking at home and not really getting out or talking to people, the group who is more isolated has much higher rates of dementia. So the prescription is to get out and talk to people. Keep the relationships that you already have strong. Invest in the people that you care about. Try to step outside the box as well. Talk to new people. You know, you're all here for this talk today, but potentially on the way out, there's an opportunity to say hello, meet someone new. All of that is really important. Practice something called intentional gratitude, which is trying every day to find a few things that you're thankful for, which could be as simple as a really good cup of coffee, which I enjoyed on the drive over here this morning, or the fact that we have had such an incredibly gorgeous fall so far. Big or small, having gratitude improves brain function, just in the same way that social activity does. And we all need to find meaning and purpose. One way to have meaning and purpose is to align yourself with organizations like the one that is sponsoring this event today that Tracy was just talking about. That's a very meaningful impact in our own community. Okay, social activity, really important. In these talks, I always get questions about, should I be doing crossword puzzles? How many of you do crossword puzzles? Okay, good. So, is there any connection between crossword puzzle and risk of dementia? Not directly, but what the research shows is the more mentally active we are, the lower our risk. This is tricky after retirement, especially, right? Because we have years of experience, we know what we like and we don't like, and over time, we start to weed out the stuff we don't like to do, focus on the things we do, and our lives from day to day become very similar and the same. That's really bad for the brain. That's putting your brain on autopilot. Crossword puzzles, word searches, things like that get you to think outside the box and are important. But the most important thing is novelty, doing new and different things. So if you enjoy crossword puzzles, keep doing them, but try Sudoku or a word search or something completely different. If you enjoy reading a certain genre, mystery novels, continue doing it, but think about every once in a while throwing in a zinger, a different type of book that you're not familiar with or that you haven't had much history with. Anything new and different that you can do, take a different route home on the drive after this talk. If you engage your brain more, you're stimulating your brain. So research has been very clear. Our risk of dementia is lower with more education, higher intellectual capacity, higher occupational achievement. This is a funny one, but true. People with bigger heads have a lower risk of dementia. Theoretically, they just have a little bit more brain tissue and can resist some of the shrinkage and the impact of that over time. So our brains are stimulated in all kinds of ways. Again, it doesn't matter exactly what you're doing, reading, writing, drawing, playing games. Try to learn a new game. Last year, my mom just moved into a cooperative called Applewood Point in Prairie. She's really gotten into this game called Mahjong, and she wanted to share that with my wife and I, and so we sat down and we were like, what on earth is this? It's so complicated, I don't get it. And she was beating us every time, which she loved. And now we play with her every other week, and it's a challenging game, and it's okay to lose. You know, we go into it with the expectation, doesn't matter if we lose. The point is we're stimulating our brains, we're thinking outside the box, and that's what's healthy. So again, just think about the way that mental stimulation changes the brain. For example, listening to me talk today, if you leave today with even 1 or 2 or 3 memories or thoughts about what I discussed, your brain has physically changed. That's what a memory is. It's brain cells connecting in new ways that they haven't connected before, and that's actually physical. One neuron has an arm that is reaching out toward another neuron, and so on. That is creating this loop, this connection, which is a memory. And so when you're going to new lectures, reading new things, thinking outside the box, taking a new route home, you are physically creating new connections in your brain. And that's what's going to help reduce lifetime risk of dementia. In case you have an interest in online computer games that have been developed by neuroscientists to help stimulate the brain, I'm not promoting these, I have no commercial interest in them, but if you are interested, there are 2 that are very good, and they're shown on the screen here, Lumosity and BrainHQ.com. They just provide a wealth of these really interesting games or puzzles that try to get 2 different parts of the brain to talk to each other that don't normally talk to each other. Okay? And I already mentioned the goal here, the prescription is to try to go toward novelty. Seek out new and different things as much as you can and avoid autopilot. Okay? Let's talk about nutrition and diet. Do you think there's any such thing as a brain healthy diet? Does what we eat really make a difference for the brain? Yeah, 100%. Unfortunately, in this country, our diet tends to be pretty poor. We have large portion sizes, a lot of processed foods, and a lot of stuff that is not good for us, and we combine that with a rather sedentary lifestyle. My mom, for a decade, took foreign exchange students, and the first year we had somebody from Norway. And his parents came over and visited me when I was in training at UCLA in California. And I took them to the Cheesecake Factory. Have any of you been to the Cheesecake Factory? That's the one that has the menu is like a catalog, and they ordered salads. Well, the salads came just heaping, over the bowl, and there were only 4 of us, and there was no way that we could eat all this food. And so at the end of the meal, they brought a grocery bag, a huge bag full of all of the leftovers, at which point the Norwegians started laughing and crying. They were laughing so hard, thinking this is preposterous that Americans are getting this much food in restaurants and taking all this home. So portion sizes are too much, and what we're eating is not the best for us. I always get questions about, what about vitamins and supplements? What should we be taking? Ginkgo biloba for memory, or Prevagen, you've seen that advertised. The truth is that when all of these things are studied rigorously, they're shown not to be effective. And that's because, in large part, our bodies are designed to obtain nutrients from real food. And it's really difficult to get nutrients from things in pill form or supplement forms. I'm not saying you should never supplement. I supplement, but in general, food sources are best. I do not eat anything that lives underwater, not because I have any issue with sea creatures, other than that there's some kind of a base taste that I don't like. And omega fatty acids are really important for your brain, and so I have to take supplements because I can't get that from real food. So there are arguments for supplementing, but in general, whole foods are best. So no one food reduces our risk of Alzheimer's disease or dementia, but here are some tips. Omega-3 fatty acids and whole grains are really important. We should be eating fish, if you can tolerate it, twice weekly, and eating whole wheat pasta, brown rice, oatmeal, popcorn, whole whole wheat and brown rice has phytonutrients, these certain chemicals that are really protective for the brain. Also a rainbow of fruits and vegetables. It turns out from an evolutionary standpoint that the brighter colors of fruits and vegetables, the more vibrant they are, the more nutrients they contain that are helpful for your heart and your brain. So super fascinating. So the next time you go to the grocery store, be thinking about the color of the items that you're purchasing. You may have heard about blueberries being extremely potent for brain health. They also have very unique chemicals that are good for the brain. Broccoli, spinach, dark leafy greens. I will say one thing about Minnesota and Minnesota salads. We often make salads with iceberg lettuce, right? Iceberg lettuce has absolutely zero nutritional value whatsoever. None. So if you can add in a little spinach, again, think color. That's what's helpful for the brain. Also red peppers, cherries, tomatoes, really important. Some of you may have heard about the spice or the flavoring turmeric or curcumin. This is an Indian yellow-looking spice that you can find in any grocery stores. It really doesn't have so much of a flavor as it has color, and it's highly anti-inflammatory. And one of the problems in Alzheimer's disease and dementia is inflammation in the brain tissue. And so curcumin, turmeric is something that has been shown to be helpful for the brain. So, big picture, what's the prescription? The prescription is something called the Mediterranean diet or the MIND diet. And you can look this up, and I'm going to give you a resource a little bit later that has more information about this. But this is basically really focusing on fruits and vegetables. You see here 5 to 10 servings of fruit and vegetables. Those high fiber whole grain foods, fish, yogurt, olive oil, avocado, beans, and nuts are really important on a daily basis if you can do it, and so on. And trying to limit red meat. And red meat is not just beef, it's also pork, for example, lamb, also considered red. So trying to minimize that as much as possible. Research shows that people who follow this sort of pattern of eating, it's not really a diet so much as just a lifestyle of eating, can reduce their lifetime risk of Alzheimer's disease by almost 30% just by eating differently. Okay, so diet turns out to be pretty darn important. You still with me? Okay. I'm going to talk about a few other risk factors that you have some control over. We know that Alzheimer's disease is a disease that is very linked to the health of the blood vessels in the brain. And in fact, many people who develop Alzheimer's disease also have had a history of stroke or breakdown of the small vessels in the brain. And so we can use that to our advantage. What is good for the heart turns out also to be good for the brain. And so in that way, we have to think about these factors like weight, smoking, cholesterol, blood pressure, and blood sugar. I'm going to show you some fancy graphs from research just to make the point. This is showing somebody with diabetes. And from left to right, the more episodes of low blood sugar, the higher the risk of developing Alzheimer's disease. So you see on the far right, if someone has had 3 or more episodes of hypoglycemia, their risk of Alzheimer's disease doubles. No, over the course of their life. Yeah, at any time. Yeah. So there are actually some researchers who are referring to Alzheimer's disease as type 3 diabetes. Okay, this is a very close link. This is just another slide talking about weight, which, you know, most of us, not everyone, but most of us have some control over our weight. The left graph is just showing you in midlife, in someone's 40s and 50s, their BMI is related to their risk of Alzheimer's disease. So the higher body fat, the higher your risk of the disease. The graph on the right is showing in late life something called hip-waist ratio, which essentially just comes down to also being overweight. The more overweight we are, the smaller the memory organ in the brain becomes. Okay, so there's very interesting relationships happening. Big picture there, just important to pay attention to weight, high blood pressure, cholesterol, diabetes. If you have any of those things, to be on top of them and following the recommendations that you're given by the doctor. Okay, sleep. This is a hot topic for a lot of people as we get older because sleep becomes a little bit more challenging for a lot of people as we age. We naturally sleep less. And many people have sleep disorders. We know that cognitive impairment, memory loss, is associated with people who are having chronic insomnia and also those who are having untreated or undertreated obstructive sleep apnea. Does everyone know what obstructive sleep apnea is? Obstructive sleep apnea is when people often snore and they are not getting enough oxygen to the brain. If you don't treat sleep apnea, over months and years, you lose more and more and more brain cells at the bottom of the brain. You never get those back. And untreated sleep apnea is a risk factor for cognitive impairment as we age. Do you know what the treatment for sleep apnea is? Those god-awful CPAP machines, right? The mask and the hose and the whole thing. A lot of people can tolerate them, some cannot. If you can't tolerate them, don't just throw your CPAP in a closet. Go back to the doctor and say, I didn't like that, I can't do it. And they'll refer you to a dentist who will make an oral appliance, just a mouth guard, that will lift the back of your palate so that you can get more oxygen to the brain. Okay, so really important to treat that. We all know or should be reminded about sleep hygiene, so trying not to take a shot of Bailey's before you go to bed. Try to minimize caffeine use 5 or 6 hours before bedtime. Try to move during the day so that you're more sleepy. If you can't sleep after 30 minutes or 60 minutes, get out of bed. Try to do something and then try again. But ultimately, we should be getting a minimum of 7 hours of sleep per night. If you're not, talk to your doctor. It's not all about medication, although there are sleep aids, obviously. There are other treatments that have been shown to be effective for insomnia. So talk to your doctor. A brief nap during the day, as long as it's less than 60 minutes, is very healthy and helpful actually for the brain. When we are sleeping, your brain cells shrink. Why do they shrink? Because they're opening up more space between the cells to flush out all of the toxins and the things that have accumulated during the day. You need sleep to flush out the bad stuff from the brain. Also, when we sleep, your brain is transferring information from short-term memory to long-term memory. So things that happen during the day get transferred into long-term storage. And if you're not sleeping well, those mechanisms are disrupted. Just as a side note, we see a lot of people in the clinic who are taking over-the-counter sleep aids. If you are doing this and it's not called melatonin, it's not good for the brain. Sleep aids like NyQuil Z's, Tylenol PM, or Benadryl all contain the same ingredient, and that ingredient removes a chemical from the brain that you need to think and remember things. So do not take over-the-counter sleep aids unless it's called melatonin, okay? As I transition to talking about a few other things, I just want to summarize by saying, again, that there are many things that we don't have control over in terms of our risk, age being the biggest risk factor for all of us. But there are many things that you can do today, and I've just gone through some of them to think about, exercise being the most robust, to reduce your risk of dementia. And this is just a slide showing that if we all paid attention to all of these things, we were socially active, mentally active, physically active, we ate a little bit better, we tried to sleep well, and so on. This is no joke. You can reduce your risk of having memory loss and dementia by 50%. That's a big, a sizable amount of control that we all have over our destiny. So again, this is really important stuff to be paying attention to. Okay, so bottom line, you have some control over your destiny and your risk, and start prioritizing a few things of those that I talked about today, if you can. My wife, Michelle, is one of the most brilliant people that I know. It's why I married her. She is also in this world of aging and dementia, and she does really cool things. She and I, in combination with a neurologist, wrote this book a couple years ago, and we spent several years looking at all of the research that's been done around the world about things that can be done to reduce your risk of getting dementia. But the book is also written for people who already have memory loss and already have dementia. What can they do to live better and have a higher quality of life and slow down the progression of memory loss? This book covers all of that. This is free, and it's available online. And you see the website there is myneurosciencecenter.com. myneurosciencecenter.com. A really good resource. Okay. myneurosciencecenter.com. You still awake? Okay. Yes. Yep. Okay. Sure. You ready? MyNeuroscienceCenter.com. Yes, and we will send out these links to all of you as well, so you'll have them. Okay? Because I know this is a lot of information on the slides. Okay. We're going to talk about now the difference between normal, healthy brain aging and dementia. How do the two differ? In normal aging, unfortunately, there are changes that happen for all of us in the brain. And the first one is that for many, not all, but many, we have sensory and motor changes. That means we start walking a little bit more slowly, our balance becomes a little bit more unsteady, and we may have hearing and seeing difficulties. Obviously, if you're having seeing and hearing difficulties, that can impact your ability to remember things, right? By the way, quick side note, if you have hearing loss and you're not treating it, hearing loss that is untreated also increases the risk of dementia. Why is that? Because the parts of the brain that are receiving sound happen to be right next to the memory center of the brain. And if those parts of the brain that are receiving sound are not getting regular stimulation, they start to shrink and atrophy. And again, because they're right next to the memory center of the brain, it is a risk factor for memory loss as well. So treat hearing loss. So we all have these, or many of us have these changes that happen. The number one change that happens to all of us in terms of our thinking, though, is that our thinking speed slows down. It is thought it's because our libraries of information become larger and larger and larger as we get older, right? And so it just takes your brain a few extra seconds to go through the stacks, because you have a lot more of them than you did when you were 4, 5, 20, and so on. By the way, we're at our quickest thinking speed at what age, do you think? 6, 19, 25? In our 20s. That's when the neurons are firing as fast as they can. But again, as we get older, then there are some mild normal changes. The first one is that we start to lose some words for people, places, and things. So this is that tip of the tongue phenomena, right? You know the word, you just can't come up with it right away. Very irritating. I'm starting to have some of that. Mental flexibility. So as we age, we approach problem solving by using all of the tried and true solutions that we've accumulated with wisdom over the course of our lives. But if those solutions are not effective, as we get older, it's a little harder to think outside the box. Our thinking becomes a little less flexible, if you will. And then memory. We can also have what are called senior moments, golden moments. This is normal. This is when you get up from the couch and you go into the kitchen and then you think, now, wait a minute, what am I doing here? Totally normal. Okay, so this is a cartoon to illustrate that point. Superman in his later years. Dang, now where was I going? Okay, happens to everybody. Okay. So in normal aging, though, we have these changes, but they do not impact our everyday functional ability. We're still able to drive and get to where we're going and balance the checkbook and make a meal and plan a trip and so on. And when we go to the doctor and we are asked some memory screening questions, we pass. We do well enough on those screeners. That's normal aging, okay? So if that's normal aging, what is dementia? Well, before I go into the signs and symptoms of dementia, I just want to lay out for you a little bit of the problem in healthcare today. The first problem is that doctors are not used to, and we're not used to, having conversations about brain health. Okay, when's the last time you had a question about memory with your doctor? You know, we should be asking everybody those questions routinely to normalize it and make it more comfortable. Despite how frequent and how common dementia is, there historically has not been any routine measurement of brain function. For example, when you go to the doctor, we are used to having our vital signs taken, right? What are vital signs? What's an example of a vital sign? Blood pressure, right, exactly. So you go in, you know this is going to happen. The purpose of a vital sign, the idea behind that, dating back to Socrates, is apparently we have some vital organs in our body that if they're not working well, we're not going to be working well, right? Like heart and lungs. But I think they forgot about the brain. Right? If your brain's not working well, also you're going to be having trouble. So we are teaching doctors now about the brain as a vital sign. So now the recommendation is every year, 65 and older, when you go for your wellness exam, a brain checkup needs to happen. Today, dementia is only diagnosed less than half of the time. If people don't get information about what's going on with them, how in the heck can they or their family members get organized and reach out and get resources and plan ahead? Really, really awful. When we do diagnose today, often we're diagnosing in the mid to late stage. So the train has already left the station. It's not early or as early as we would like to really help them thrive and do well. So I also talk about the health system's approach being diagnose and adios. That means you've got dementia, take this pill, see you in a year. What does that do? Very unhelpful. Okay, so this is all going to change, but it takes a while to train doctors. And our system also, after a diagnosis of dementia, is just all about taking things away from people, right? You can't drive, you can't live at home anymore, you can't do this, you can't do that. Again, it doesn't need to be that way, but we need to change the healthcare system. So how common is Alzheimer's disease? I mentioned before, if you're lucky enough to live to the age of 85, the chance is somewhere between 1 in 2 and 1 in 3. Most people, as you can see by that pie graph, the purple there, are 75 years of age or older. So again, this is a disease of older age primarily. Although, is it possible to get Alzheimer's disease as a younger person in your 30s and 40s, 50s? It is. Same disease, but just a different age bracket. It's rare, but it does happen. So what is dementia versus Alzheimer's disease? How many of you feel confident that you know the answer to that question? Very few. Okay, yeah, and this is normal because we don't talk about this enough. So what is the difference between dementia and Alzheimer's disease? Dementia is a very broad term. It just means that there is something happening in the brain that is causing a decline in memory and thinking that is severe enough to impact your everyday life. But the word dementia does not tell you what disease is causing the problem, okay? So then we know dementia is not normal aging. So my analogy here is when I say the word flower, you understand what that means, but it's also a generic term, right? There are many, many different types of flowers, and the same is true for dementia. There are many, many subtypes of dementia, and Alzheimer's disease is just one of them. On the screen here, and I could show you 5 more slides with all the things that cause dementia. This is just some of them. You can see brain tumors, normal pressure hydrocephalus, traumatic brain injury, MS, HIV, AIDS, Parkinson's disease. These can all lead to dementia. But again, Alzheimer's disease is the #1 cause of dementia. This is just showing you that Alzheimer's disease accounts for 3 out of 4 of all dementias. So if there were 10 people at the up front with me here, and you guessed that all of them had Alzheimer's disease, we didn't know what type of dementia they had, but you guessed all of them had Alzheimer's disease, you would be right 3 out of 4 times. So most cases of dementia are due to underlying Alzheimer's. So what is Alzheimer's? What is happening in the brain? Remember I said earlier that the brain pathology is accumulating for 20 years before people have memory loss. It turns out we all have the ingredients for Alzheimer's disease in our bodies. We have these protein chains called amino acids, which you can think of like a pearl necklace, okay? And they're in our brains and our bodies. And our bodies are used to metabolizing big, long chains. So in the brain, you have these pearl necklace-like structures, and the brain is cutting these structures into pieces to break them down into smaller and smaller chunks that they can use. This is like digestion. When you eat an apple, your body is breaking that down into smaller and smaller components to get the nutrients. In Alzheimer's disease, for reasons that we don't understand, our brains cut that pearl necklace in the wrong place. Nobody knows why this happens. When that amino acid chain is cut in the wrong place, all of a sudden we have these 2 parts that the brain does not recognize. These become foreign bodies. What happens in the brain when you have foreign bodies that the brain doesn't recognize? The brain tries to get rid of them. But these pieces are too large to get out of the brain, so they get stuck. They get stuck in the brain. If your brain can't get rid of them, what's the next best thing to do? To gather them all up together in heaps and piles. So the brain starts to collect these chunks and put them in like trash heaps. And that's why for the first few years, first 10 years, 15 years, that when people have these trash heaps accumulating, the brain is able to navigate around them. But over time, the trash heaps become so numerous and all over the place that the brain can no longer cope and people start to have memory loss. So this amyloid, these plaques, are just these accumulation of this abnormal protein. Neurofibrillary tangles, that just means that the cells begin to die and all the things inside the cell start to float out in the brain like space junk. And so we get all of this tangled mess of stuff that's not supposed to be there. I'm going to show you now what these brains look like after death. So on the left is a plump brain of somebody who is 75, and on the right is the brain of a 75-year-old with Alzheimer's disease. What do you notice? You notice all the shrinkage, and that's all of the cells over time that die and cause memory loss and thinking changes. Alzheimer's disease progresses at a rate that is unique for each person. So these benchmarks that you see on the screen are simply averages. Keep in mind that many people are diagnosed late in the disease, but if diagnosed early, we know that the, quote, early stage, the beginning of memory loss, that stage can last anywhere from 1 to 5 years. The middle stage, which is when people begin needing a fair amount of more support at home, can last 1 to 10 years. And late stage, this is typically when people need 24-hour care or a skilled nursing facility, is 1 to 5 years. But again, just averages. The Alzheimer's Association publishes these 10 warning signs of Alzheimer's disease, which I think are helpful, and so I just wanted to review them with you quickly. On the right are the warning signs, and on the left is the analogous issue that is normal. So the first warning sign of Alzheimer's disease is memory loss that's so great that it's disrupting your daily life. Normal aging is every once in a while forgetting an appointment or a name. The second warning sign of Alzheimer's disease is challenges in planning or solving problems. That would be like somebody who's always been able to plan a trip to Arizona every winter, but this winter is really befuddled and can't figure out the process to do that. Normal aging means occasional errors in booking a flight or balancing a checkbook. The third warning sign is difficulty completing familiar tasks at home. And of course, normal aging means we need help every once in a while to figure out the damn remote control, or how to record something, or figure out something on the computer or the printer. All of that's normal. The fourth warning sign of Alzheimer's disease is being confused about time or place. But it is normal, particularly after retirement, to not know the date or the day of the week, to be a little bit off. So don't be worried. I'm somebody, when I go on vacation for 2 weeks, I have no idea what day it is or what the date is. That's normal. The fifth one, or warning sign of Alzheimer's, trouble understanding visual images and spatial relationships. This is what leads to people getting lost while driving in familiar locations. It is normal, though, for all of us to get turned around every once in a while when going to unfamiliar locations. Another warning sign of Alzheimer's disease, having so much word-finding problems that it's causing you to stop and hesitate and halter and have a lot of difficulty communicating ideas. But remember, it's normal to occasionally have the tip of the tongue phenomena. Next warning sign of Alzheimer's, misplacing things, which is normal, but then losing the ability to backtrack and systematically trying to find what you've lost. And the last three, decreased or poor judgment. This is really sad because we see a lot of people who come to us in the clinic to get a diagnosis of dementia after family members uncover the fact that they've been scammed and defrauded out of many, many thousands of dollars. The scammers are really getting sophisticated, and I'll tell you, it's harder and harder to determine what's real or not. And even people who don't have dementia are very susceptible to that. I've clicked on links that I should not click on, for example. It happens, but it's especially the older population and those with dementia especially vulnerable. Last two symptoms of Alzheimer's disease, a significant withdrawal from work or social activities. This is particularly true in early stages of Alzheimer's when people have a little bit more awareness of their memory problems and word finding problems. If you're having memory problems and you can't remember people's names, for example, it's embarrassing to be out with your friends because you're worried, you're afraid you're going to have a lapse or repeat yourself, and people start to withdraw and stay at home more, which is not productive, but it's a normal thing. Last thing, changes in mood and personality. Someone becoming more irritable when they were never like that before, or more depressed or apathetic. that can be a warning sign of dementia as well. So the question becomes, should I get tested? And what do I do if I'm concerned about memory issues? So what I said before, I think is true, and again, we're trying to educate doctors about this and change healthcare. Every one of you, when you go to the doctor, if you're 65 or older, should be getting a memory screen by the nurse during that visit. And if you're not, you should ask for it. Say, I want a brain health checkup as part of this evaluation today. There are tools that can be used that only take 3 minutes to assess someone's brain health, and they're very effective. If you don't have any symptoms, in other words, you're not having memory loss, your spouse or family has not told you you're having memory problems, and you pass those screens, then you don't need to do anything for a year until the next time you go back to the clinic. We do not need everyone to have extensive cognitive memory and brain testing to get a baseline. You don't need a baseline. If you don't have symptoms and you pass the short screen at the physical, you're good to go for another year. If somebody in your life is telling you that you're having memory problems, or you're noticing memory changes of concern, or you don't do well on that cognitive screen in the doctor's office, then you should absolutely seek an evaluation. And that's called a memory loss workup. And you can ask your primary care doctor to do that for you. If your primary care doctor is not comfortable with that, you can ask for a referral to a neurologist. But, pro tip, if your doctor doesn't want to give you a referral to a neurologist, you can make your own appointment to see a neurologist. It's covered by Medicare and insurance, and you don't need a referral. So don't let doctors who have a little less information about memory loss stop you. Okay, so we should all be proactive about our health. How is dementia diagnosed? Really, this is a series of pretty straightforward exams. We do a standard medical history, a physical history, and something called a neurological exam. And that's really just having you walk to look at your balance and your gait, testing your reflexes in the office, and asking you questions about memory and brain health. We will ask you to do some lab work, some blood draw. There is no blood test that diagnoses dementia. The purpose of the blood test is to rule out vitamin and nutritional deficiencies that can cause memory or thinking changes. Okay? We may also recommend a brain scan. It's not always necessary, but sometimes a head CT or a brain MRI is used. Can we see Alzheimer's disease in a brain scan? Rarely. The brain scan is designed to rule out other causes, a stroke or swelling in the brain or a mass or something else that's unusual. And then we will also ask you to do some cognitive testing or some memory testing, and maybe see an occupational therapist for something called a functional assessment. So this is all very, very standard. No single test can diagnose dementia, but together, all of these things can diagnose dementia with a great deal of certainty. Is it true today that we need an autopsy to diagnose Alzheimer's disease? To be 100% certain, yes. But today, if doctors follow the recommended pathway and workup, we can diagnose Alzheimer's disease with over 95% certainty. So we don't need to wait till an autopsy, okay? Are there medications to treat dementia? Yes. Are they effective? Not so much. And this is unfortunate, but the science is really evolving, and I'm going to share something super exciting with you at the very end as I talk a little bit about the future of research. So you've heard about some of these pills, donepezil, Aricept, memantine. What they do is they increase a chemical in the brain that you need for memory. And on average, they help people slow symptoms for 18 months on average. So it's not that people shouldn't be taking them, it's just that they're not a silver bullet. It's not a cure. And in fact, the medications do not stop the brain pathology. They do not do anything to change the disease. It's just simply tackling the symptoms. Okay, so they're not a cure, but they are prescribed in a lot of cases. This is my attitude in medications in general, which is, this is another one of my favorite cartoons, the woman coming back to see the doctor. I feel a heck of a lot better since I ran out of those pills you gave me. A lot of people are taking a lot of medication, and when they come to see me and others in our clinic for memory loss, one of the first things we do is look at their med list and try to help them safely get off bad drugs that they're on for the brain. Okay? I'm going to switch topics briefly and just tell you about my 10 golden rules for caregiving. And we're going to talk a little bit about caregiver stress and how to help caregivers. Caregiving is hard, really hard. And I mentioned at the front end of this talk that my family and I cared for my grandmother at the end of her life in my mom's home until the end of her life at the age of 97. She had early stage Alzheimer's, and my mom is a nurse practitioner, and she has several other nurses in the family, siblings that all live in the area, and that was the only way that we were able to keep my grandma at home, because had it just been one person or two people, it would have been too much for us to handle. Caregiving is hard and it's stressful. The first warning sign of caregiver stress is to be in denial that it's stressful. Because it is for most people. If you're a caregiver and you feel angry sometimes, irritable, depressed, if you're smoking more, drinking more, not going to the doctor often for your own needs, you feel exhausted, join the club. There's a lot of people in the same boat who are really struggling. The problem is that research shows caregivers who devote themselves exclusively to the person with dementia have a very high risk of getting sick themselves. You cannot be there for somebody with dementia if you are unwell emotionally, physically, spiritually. So you have got to invest in yourself in order to show up your best for the person that you care about. So again, research crystal clear. Actually, the mortality, the death rate of caregivers skyrockets because a lot of caregivers ignore their own health. So don't fall prey to that story that we see often in the clinic. As caregivers, and I think as Minnesotans, we need to be better about asking for help. My family is from Gregla, Minnesota, population 200. An hour past Thief River Falls, way up in the middle of nowhere. And it's farm country, of course, and my family all learned to be self-sufficient and be independent. And it's very hard for anybody in my family to ask for help. I'm the exception, of course, but the rest of them really struggle. So this is about, we develop relationships and are relational creatures for a reason. Your survival depends on your network. And one of the gifts of relationships is being able to lean on people when you need it. So don't forget about that. Be proactive in asking for help if you're a caregiver. Think about what some things are that someone could do for you. Because even somebody doing one small thing could potentially give a caregiver, an hour to take a nap or take a shower or just have a minute to think or go to the grocery store. It can make a big difference. The other thing I would say is that, and this is very sad to me, is that there's not enough planning ahead as caregivers and family members. Many of us want to take care of our loved ones at home as long as we can. The truth is, in many cases, most cases, that becomes very difficult when people start falling or become incontinent. They lose control of bowel and bladder and all of these things that really require the help of a nurse. You can avoid crisis mode by trying to make some plans, because think of this as insurance. You can make plans that you never use. That's much better than not having any plans at all. I'll tell you one common scenario is that Someone with dementia will be cared for at home, and then as things progress, their condition declines, they have a medical crisis, they go into the hospital. They go into the hospital, and then the social worker at the time of discharge figures out this person is too ill, they're too compromised, they're not thriving at home, they can't go home. They need a placement, they need a nursing facility. Well, can you just waltz into any nursing facility and get a room right on the spot? No. Assisted livings, for example, today often have a waiting list of over a year. So if you even think there's a remote possibility that someone you're caring for may eventually need that, get the name on the list. A year from now, when the name comes up to the top, you can say, we're not ready, but your name stays there. You don't lose your place. So if you think ahead, you'll be in a much better position, a safer posture, if you will. There are many ways that if you're not caregiving, you can support somebody who is a caregiver. The first one is by offering to do something for them and not taking no for an answer. Because you know as a Minnesotan, when you say, I would love to help you, the first response from the caregiver is going to be, no, thank you, we're fine, I'm good. That's not true. They're not fine and they're not good, so keep pushing. And be specific. You know, maybe I could take John on a walk for 30 minutes every Wednesday morning so that you could get ready for the day or relax. Or maybe you could give me your grocery list and I could pick up some things for you every once in a while. Every little bit is a gift, so be thinking about ways that you can try to look out for caregivers. So these are 10 golden rules for caring for somebody with dementia. Okay, just some lessons that I've learned over the 20 years of doing this. The first one is that acceptance is unnecessary. This means that many people who are developing dementia, Alzheimer's disease, don't have awareness or insight about the fact that they're having memory loss, right? They can't remember that they're forgetting. They can't remember that they were diagnosed with Alzheimer's disease. This can be really frustrating for people, but it doesn't matter at the end of the day. It does not matter that the person accept the fact or know the fact that they're having memory loss or that they have dementia. In fact, we should all see ourselves as robust individuals. So this example is a kitten whose reflection is a lion. And how cool to see oneself as that strong, even if it's not the case. So acceptance is unnecessary. Number 2, generally speaking, medication is a last resort, and I'm going to give you an anecdote about this. About a year ago, I saw a couple. The man was coming in to get a second opinion about a diagnosis of Alzheimer's disease. In the consultation, his wife said that she is absolutely distressed because one of his symptoms is that he does not believe she is his wife. So Fred believed that the woman that was with him was a doppelganger, somebody that looked like his wife, talked like his wife, walked like her, dressed like her, identical, but an imposter. And then at times he would also have the delusion that there were 2 wives, that the wife that he was living with was his wife, but there was also another person that looked just like her that was also his wife. Okay, so 2 wives. So I separated, we'll call him Fred and Elaine. I separated Fred and I was talking with him more about this. And what I came to learn is that Fred was not particularly, most of the time, was not distressed by this. Because after all, he had been married for over 50 years, he really loved his wife, and he had 2 wives that he really loved and cared about. So 2 is better than 1, right? So Fred was in a fairly happy place with this. So then I met with Elaine. Elaine was completely undone, completely, and I understand why. I teared up with her. She was very distressed that at times he wasn't understanding that she was the only wife and there wasn't another one, and she was trying to convince him of this, which was fruitless. Then, we went through the diagnostic process. He had Alzheimer's disease. We were talking about treatment, and the question came up about medication for this delusion of his. Elaine wanted us to give him something that would stop this delusion. But the question that we had was, who is distressed by this? Is it Fred that needs medication? Or Elaine? No, I'm not advocating that Elaine need medication. I'm just saying that one has to think about, before you jump toward medication to treat something, you have to think about who is this distressing and why, and is there a different approach? And the different approach we took was to work with Elaine over a series of weeks and months with social work and give her some strategies that she could use to cope and come to some acceptance about this. So neither one of them needed medication, and it was a good outcome. Number 3, change will always be disruptive in the context of dementia. Dr. Barclay, what kind of change are you talking about? Yes. Any change is disruptive. So that means if, to the person with dementia, that means the schedule day to day is always changing wildly and there are too many activities going on, or somebody transitions from one place, home, to assisted living, it's going to be disruptive. And for 3 months, on average, they're going to have more memory loss, more agitation, irritability, completely normal. All of us resist change, and someone with dementia needs more time to adjust. If you have ever placed someone in an assisted living or memory care unit and had guilt about that because for a while they were really struggling, no, it doesn't mean the decision was wrong. It just means change is hard. And if you have a brain disease, it's especially difficult. Okay, so change is disruption. Number 4, cognitive workload should match our cognitive capacity. If I take 5,000 paper clips and put them on the desk, pick one up and straighten one end, and then throw it back into the pile and mix it up, and ask you to find that paper clip in 60 seconds, how easy would that be? But what if I put 2 paper clips on the desk and bent one end of one and set them down and asked you to do the same thing? Could you do that in 30 seconds? Yes, you could. In the context of dementia, we have to change the task complexity to match the person with dementia's ability. So we always have to be trying to think about simplifying. Instead of taking everything away, how do we simplify? For example, maybe Fred was always the money manager at home, and to take that away from him would be a real blow to his ego. Is there a different way to do it now that he's impaired? Well, maybe Elaine figures out the bills and writes out all the checks, and then sits down with Fred and has him sign all the checks, right? So he is still involved. He has that sense of dignity and contribution, even though Elaine is really doing most of the work. But Fred is still involved. We're just changing the capacity for him. Number 5, validate and redirect. This means you're never going to convince someone with dementia that you are right and they are wrong. If they're seeing a woman standing here in a red dress, or they're saying, take me home, this is not my home, you're never going to convince them otherwise. The important thing is to think about the emotion and to validate that and move on. For example, that's really distressing, I'm sorry that's happening, let's go over here and do X, Y, Z. Okay, so validate and try to redirect them to something else. Number 6, never argue. This is on the same theme. You're never going to win an argument, and it's not important to win arguments. This is a brain disease. We have to accept that and try to move forward. Statements are better than questions. So, Fred, do you prefer apples, oranges, melons, passion fruit, pears, plums, peaches, bananas, mangoes, kiwi fruit? No. No. Do you want A or B? Which one? We give 2 choices, and they choose one. We don't say, would you like to take a shower today? People who have dementia often get afraid of showers, baths. We say, would you like to do your shower in the morning or in the evening, right? You get to choose. They have some control, but they're taking a shower one of those times. Number 8, emotions are contagious. The emotional parts of the brain are preserved in the context of Alzheimer's disease. So that means if you smile or you have an angry expression, although someone with dementia may not always understand the words and the context and remember everything, they can pick up very quickly. They become very good emotional readers of other people. So it's very important to present yourself in the right emotional space, particularly if you're trying to get some cooperation from somebody who's struggling with dementia. Number 9, we all need meaning and purpose. This is Edgar finds his purpose by finding random stuff to put together from the couch. This is an old Far Side cartoon. This goes back to the example of the checkbook with Fred and Elaine. Fred, you got to think about how to continue to involve people in ways that they can be involved and feel empowered and be part of something that is meaningful for them. And number 10, we all need to be more mindful and focus on caregivers. So this is a psychotherapist, and the client is saying, I'm right there in the room and no one even acknowledges me. And that's the caregiver. We don't see caregivers and often ignore them. Okay, in the last 10 minutes, I'm going to share with you my top recommendations. There are just 5 of them for resources and supports, and then I'm going to say 2 minutes, 3 minutes maybe, about the future of Alzheimer's disease care and support. The first one I already mentioned earlier. That's this NeuroWell book, myneurosciencecenter.com. You've all written that down, and again, we will provide you with these links a little bit later. Number 2, if you are working with or supporting at home somebody with dementia and there are mood or behavior changes that you're struggling with before you jump to medication, this book, which is available on Amazon and other online retailers, is written by a PhD level occupational therapist who has spent 40 years working with people with dementia, and the book is organized by behavior and then gives a bunch of really common sense, super helpful strategies, behavioral and environmental strategies, for helping to reduce those behaviors. It's a game changer, really, really dynamite. Coping with behavior change in dementia. Again, you'll get this information, so don't worry about capturing everything. Coach Broyle's Playbook. This is another thing that can be ordered online. I think it's like $10. Coach Broyle was a famous football coach, very skilled, also turns out a very loving husband of a wife with dementia. He took care of her at home. He learned a lot. This book is organized by early, middle, and late stage, and it's all about how to stay emotionally connected to people who are losing their memories. Incredible insights. It's very easy to read, bullet points, just a dynamite resource. Coach Broyle's Playbook for Alzheimer's Caregivers. Number 4, this is an A to Z guide. If you're somebody who likes to have all the facts, this is written by a social worker and a doctor and another expert, and it just talks about everything anyone ever wanted to know about Alzheimer's disease. And again, if you really want to dig into the details, it's one of the best resources out there. The last thing I would say about resources is that the Alzheimer's Association has a dynamite presence in our community. They're a nonprofit organization, and they have a 24-hour helpline that you can call at 3 in the morning if you're pulling your hair out or you have a question about Alzheimer's disease. They provide support for any type of dementia, frontotemporal dementia, vascular dementia, any kind of dementia. The name is a little bit of a misnomer. Alzheimer's Association, they do much more than that. They have support groups, all kinds of really helpful stuff. Okay? You've hung in there. We just have 5 more minutes of me being a talking head, and then I'll take questions, and if you have to go at 11:30 in 7 minutes, go for it. I won't be offended. If you want to stay and ask questions, feel free. I want to just highlight 2 really, really interesting totally different areas of research to understand. The first is about the microbiome. What is the microbiome? The microbiome is your gut and everything in your gut. Scientists refer to that as the microbiome. It turns out that we have a symbiotic relationship with thousands of microorganisms that live in our gut. And you can see on the slide here that in every square inch of our guts, we have over 1 trillion of these little buggers. Yikes. In fact, our human health depends upon the things that these microorganisms are eating and excreting. So maybe some of you have heard about serotonin. Serotonin is a chemical that we have in our brains that regulates mood. Medications like Prozac help to regulate the availability of serotonin. Scientists used to think serotonin was made in the brain. It turns out it's made in your gut. And many brain chemicals rely on the health of our gut to be making healthy chemicals for our brain. So the point here goes back to nutrition and what we're eating, because there's an incredible connection between brain health and gut health. This research started about 7 years ago when this study was published that was just kind of mind-blowing. What they did is they took mice that had Alzheimer's disease. There are these mice that are genetically engineered to have Alzheimer's disease. And they took the mice, their feces, and then put it in liquid and spun out all of the microorganisms from the mice that had Alzheimer's. Then they inserted those microorganisms into the intestines, the guts of healthy mice. And do you know those healthy mice developed Alzheimer's? Now, what was so shocking about this is it had nothing to do with changing anything in the brain, just the gut. So this opened up a whole line of research about how maybe we can change what's happening down here to affect what's happening up here. So it turns out, again, there's this strong relationship between the gut and the brain. And researchers are working on all kinds of things. For example, maybe there is a diagnosis of Alzheimer's that could be made just based on a stool sample. Now, that doesn't sound super pleasant to give a stool sample, but it's a heck of a lot easier than going through all these tests, right, that I mentioned earlier. So that could be a total game changer. Or maybe there are certain things that we can change about the gut that could reduce the symptoms of Alzheimer's. For example, has anyone ever heard of the infection C. diff? If people have C. diff that is intractable and cannot be treated and becomes very severe, do you know what the treatment is? It's a stool transplant. So typically a family member who's healthy will donate a stool sample that is implanted into the person with C. diff. Why do they do that? Because it changes the microbiome and gets rid of the infection. And so again, researchers are thinking about how these two things are related. And there's preliminary research looking at certain types of foods, yogurt, things that have active cultures, fermented foods, kefir, if you've ever heard of that, which is like a liquid sour yogurt, kimchi, kombucha, pickles, sauerkraut, all these things that have a lot of microorganisms. So we're going to be hearing more about this going forward. My last slide is just about a breakthrough in the treatment for Alzheimer's disease that came out in 2021. For the first time ever, there was a medication that was FDA approved called aducanumab. There's a lot of people that get paid a lot of money to come up with these wacky drug names. Aducanumab, so easy to say. Aducanumab is not an oral pill, it's an infusion. So people go to an infusion center twice a month and get hooked up to an IV. And this medication circulates in their body for about 30 minutes. The medication goes into the brain, attaches to these amyloid trash heaps, the pathology that I was talking about earlier, and helps it escape from the brain. It pulls it out of the brain. About 80% of the people in the study who took this drug for 18 months, by the time that the study was over at 18 months, they had 0 amyloid in the brain. So this drug is remarkably effective at removing amyloid, the brain pathology. What we don't know is if it helps people in the long run to remember better and think better. The idea may be that it simply stops the disease in its tracks, which would also be a gift. If we could diagnose people earlier, start the medication, they would not decline. That would be amazing. This is a mind-boggling discovery, and it's going to lead to incredible advancements and treatments going forward. There will be a cure for Alzheimer's disease. So, we're at the very beginning of this whole line of research, but really amazing. This medication, by the way, it is covered by Medicare. It is FDA approved. Yes, which is shocking because of how costly it is. You can imagine how much money it costs a year to be on the drug. But it is covered by Medicare. It is not without risk. So there's a lot of risks involved, and people have to go through a lot of hoops to qualify. HealthPartners, Mayo Clinic are a couple of the sites in the state that offer the treatment. But again, this is just the start of something really incredible. This was so much information. I do a lot of education and training, and I've days and days of talks that I could give. It is 11:30. Again, if you have to run out, there's no love lost. I understand. If you have questions, I will stay here, and we can talk about anything that's important to you. I'm a researcher. I have a family connection, as I mentioned. I diagnose people in clinic. So if there's any questions that you have about anything, let her roll. Yeah.
I'm a singer, and I happen to think singing is awfully good for your lungs, and it also keeps you awake on a long drive. So I would say I'm 90 years old, and I'm still pretty healthy because I sing a lot.
Do you know that there is...
Can you repeat the question too, so everybody hears?
Yeah. The question is, it's really a statement rather, about the connection between singing and health and brain health. That is actually a scientific fact. There is a lot of research about how, again, just like the emotional parts of the brain are preserved in the context of Alzheimer's disease, so are the music parts of the brain. And it turns out the music and emotional parts of the brain are neighbors. So music can really touch people with Alzheimer's disease and dementia. And in fact, we're in a community that has a really neat resource called Giving Voice Chorus. Giving Voice Chorus. If you've never heard of that, there are at least 5 in the Twin Cities, and they're for family members of somebody with Alzheimer's or dementia and people with cognitive impairment and dementia. And they put on these great concerts, and you see these people. Actually, it's very emotional for me because you see people who can hardly speak. They've lost so much of their language because of Alzheimer's disease, but they can sing. It's really amazing. So Giving Voice Chorus, if you get a chance, look that up. They have a website. Good insight. Yes? That's such a good question. Where do we get all this information on the slide? I'm okay with making the slides available in PDF format if there's a way to do that. Okay. Yes, and Tracy said we're also videotaping this with all of the slides. So
if you register and we have your email address, when that information is out on our website, you'll be notified.
okay, yep, it'll be on the website.
Well, actually, what would probably be better, we have Facebook videos where we can post it on our Facebook site and also on YouTube. So the church YouTube sites and the Facebook sites.
Okay, so both sites.
I'll work on uploading this video to those two sites, and then make sure Tracy gets the links to those so she can email them out.
Okay, so she'll email out the links to where you can get the slides and the video recording if you want it.
We'll also recap and summarize the presentation, give you the highlighted bullet points and links, and we'll do all that for you.
What else? Yes. No, go ahead. It's okay. Yeah. 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 Yes, so where do you go to get a diagnosis? HealthPartners Center for Memory and Aging. HealthPartners Center for Memory and Aging. You can self-refer. It's the best memory clinic in the Twin Cities. The number is 651 495 6200. 6200. The Center for Memory and Aging is located in St. Paul. It's worth the drive, even if you're on the west side. Yeah. Again, you can self-refer. You call and you say, I want an appointment with the Center for Memory and Aging, 651-495-6200. Okay? Yes. Yes. Yeah, it's not a study, it is a treatment. Yes. So the HealthPartners, if you are a HealthPartners, if you're a patient of the Center for Memory and Aging, that is a treatment that is available if someone qualifies. Again, there's a lot of risks and benefits, so one has to qualify, but we are one of only 2 sites, I think, us and Mayo, in the state that offer it. Yes. Yes, very good. Yeah, so some centers have access to what are called biomarker testing. Biomarkers are just biological evidence of the disease. There are essentially 2 types. One is a fancy brain scan where you inject somebody with a tracer, it's called, that lights up the brain pathology in a scanner that confirms Alzheimer's, or you can have a spinal tap that looks at these proteins and can confirm. These biomarkers are 100% certain. So it's just like an autopsy. Not everybody has access to that, but places like HealthPartners, we do those. Yeah. Yeah. Yes. That's a good question. Is there a difference, men's brains versus women's brains, in terms of dementia? Yes and no. Women are at a higher risk of developing Alzheimer's disease. However, the thought is that is because women, on average, live 7 years longer than men. And Alzheimer's disease is a disease of aging. So that's really our understanding. The understanding is not necessarily that there's a biological difference in the brains. It's more about women living longer. That's a good question. Yes? So the question is about statins and whether they can cause thinking changes like word-finding problems. This has been extensively studied, and what I would say is that there has been found no association between using statins and any kind of memory or thinking changes, risk of dementia or anything. In fact, if you have high cholesterol, and you don't treat it, you are increasing your risk of Alzheimer's disease. So you should absolutely be treating your cholesterol, whether that's through medication or diet. That said, the caveat is there are so many things in our bodies that are unique, and could one person have side effects that are a little different than others for Crestor or similar medications? Yeah, it's certainly possible. But in large numbers that are studied, there's no association. That's a good question. Yes? So the question is there a correlation between irritable bowel syndrome and Alzheimer's disease? We don't know that yet. Because these studies in the microbiome, the gut, are so new, there hasn't been enough time to look at specific conditions like IBS. All we know is that, generally speaking, there is this association between brain and gut health. Yeah. Right. Yes. Can you say the first part again? Did you say gray matter? Gray matter on brain MRI. Gray matter is just the, bless you, it is just, how can I say this? No, there is not necessarily a direct link. What we often see in brain scans, though, of older adults, it's two things that are normal. One is a little bit of shrinkage, because brains shrink naturally with age. And number two is what we call some white matter changes. Gray matter is the actual neurons, the cells. White matter is the arms that they use to connect out to other cells. So what happens is, as we age, the teeny tiny blood vessels of the brain start to have wear and tear, and this white matter starts to deteriorate a little bit. And for most people, that's completely normal. Most brain scans of people with Alzheimer's disease look essentially normal. There's not much today that we can typically see. And what was the second part of your question? The difference, yeah, any thoughts on nursing home care versus memory care? The thing is that this has become such an interesting industry. 20 years ago, assisted livings were really providing fairly light level of support, and really it was nursing homes that people went to when they really needed a lot more help. Today, every type of assisted living and community of care has so many different words that they use to describe these things that the distinctions have really been blurred. So assisted living with memory care is really what a nursing home used to look like, you know? So it's hard to answer that question because every facility, you know, kind of talks about those things differently. Really hard. Sure. One more question. Yes, in the back. Is the question, can medications cause Alzheimer's? Yeah. That's a very good question, and the answer in general is no. That broadly speaking, there are not direct correlations between medications and Alzheimer's. However, there are many bad drugs for the brain that cause memory loss and thinking changes. And I mentioned even some over-the-counter like Benadryl, Tylenol, PM are bad for the brain. But there are no prescription medications that today we understand cause Alzheimer's. Okay, I'm going to stick around for a little while. If you have more questions, feel free to come up. Thanks for being so engaged and for being here today. Appreciate it.
What a privilege to have Dr. Barclay here. And he said he'll stay around, and we have nurses and advocates who will be back by the tables by Start Senior Solutions if we have any kind of question that you'd like to ask and have answered. Thank you so much. You guys have been wonderful. A lot of learning today. Thank you.